two answers to that.
I'm going to ask that again. Let me try
Five
again.
answers to that.
Hey, everybody. Welcome back. I'm Mike Russ with ProEdge Dental Water Labs, talking to my good old friend, Nancy Dewhirst. We've known each other for a long time.
Long time.
Hey, Nancy, I got a question about patient screening.
Okay.
Do we treat patients differently based on their answers to our screening questions? In other words, I think the biggest question is, have you been with someone who has been diagnosed or exposed? Or have you been exposed to someone? Is that how we ask that?
Well, there are specific questions that we can ask, and CDC has a nice little checklist for us that we can ask. But basically what you're trying to discern if somebody, first thing is, are they symptomatic? That's the biggest thing you're going to question. And we have clear guidance about treating people who are symptomatic, that they need to be referred, and at this moment, not treated in the dental office unless they can be treated with full respiratory protection. So probably refer those cases, unless, what if it's an emergency? And now you find yourself, oh my gosh, I have a fever. I'm not sure. There's no diagnosis, but it could be. You ask them another question. Could they be exposed? Yes, I was just traveling. I mean, let's just say. So now it's highly suspicious, but you feel that they need this dental emergency treated right now. The guidance is that you would prefer to refer them to a place where full respiratory protective policy can be in place, including a negative pressure room and fit tested respirators and the whole 9 yards. In a dental office, we assume that people don't have that negative pressure room, the measurable air exchanges of the ambient air. They may not even have fit tested respirators in a full program where everybody is truly comfortable about how to use these respirators. We've all been told all of a sudden we have to wear them. Very few of us have actually gone through fit testing, answered all the questionnaires. We're not sure that we can sustain wearing them all day. So there's a lot we haven't done to prepare for this. And that's why, based on screening, you would refer somebody in that situation. Now, if they're asymptomatic and we've screened out for symptoms and we don't perceive any real risk, they're classified as an asymptomatic well patient. And the CDC gave us clear guidelines on that. And right now, since 25% of those well people could be asymptomatically shedding, we have to assume that they may be able to transmit the disease. So we have to take full precautions right now until we know different. That's what we've been told. So a 95 respirator at least, probably with a face shield too. And then there's a sequence of donning and removing our personal protective equipment that's slightly different than what we did before in that you glove up, you gown up, you dress your face, you do everything before you enter the operatory. And that's kind of a transmission-based precautions alteration from standard precautions. So that's what we're told to do right now. Just because you have that zone, we don't know how many people are infected. Even if you screen them, you do your best to screen them. You screen for symptoms, you screen for risk, and then you still might not know, so you have to take a certain level of precaution.
Good stuff. Thanks, Nancy. Let's do this again soon.
Okay, you're welcome. Thanks.